Could you explain something for me? I've been speaking to a lot of care providers and they are getting increasingly worried about the way funding is being implemented when a patient leaves hospital and moves directly into a care home. Can you give me the lowdown on what's going on there?
Yeah, Debbie, so my understanding of this is that because obviously the hospitals are under immense pressure dealing with the COVID crisis, people need to leave as soon as possible. Where they can, they're being discharged to their own homes and assessed there. But if they do need to go into a residential care setting, then it's been agreed for an emergency period that the NHS will pay the fees in full, no contribution required from the individual. And from talking to a care provider and the couple of cases they've had, it's sorted directly between NHS and the care provider. Now, for the short term, that's absolutely fine, but of course this funding will be reviewed as soon as the emergency period is finished, and we don't have a date for that yet. So the issue might be for care providers, if they've asked no questions about the person's financial situation, if that NHS funding is withdrawn, then they may end up with somebody who should be funded by the local authority, might not be able to afford their standard fees and so on. So I guess really our guidance to the care providers is if they can encourage the family to have a chat with a specialist advisor such as ourselves, we can at least predict how the future might look so that there's no nasty surprises for people.
Yeah. So there's no set time by the local authority or the NHS as to how long they will pay these fees, these COVID emergency fees?
Not as far as we're aware. It's just being stated as an emergency period and they will state when that lifts. Yeah.
Okay. And am I right in saying that there is a letter that is being given to patients and their families saying that they may need to move again if the care home they've gone into isn't going to work for them?
Yeah, that's right. I don't know whether you'll be able to see it on here, but a hospital discharge letter, and it does say in there that absolutely, you know, you're going into this particular setting because it's available, and it means the discharge is speedy, but it doesn't mean to say that another move might not happen after the initial discharge. So families should be aware, but whether they'll have taken that information in, of course, at a time of difficulty remains to be seen.